Hello, doctors. This is Dr. Brony here. Hope you are doing well, and I hope you can see me. Please, I want to know whether you can hear my voice. So please, if you can hear my voice, just type yes. I can hear your voice. This class is going to be very straightforward and very simple, and we're going to make sure that we rock the exam. Okay, the NAC OSCE. So this afternoon is basically for NAC OSCE. We're going to keep it simple because tonight we have a live NAC OSCE class as well. So I just want to make sure that those who are attending the class will be able to pick something up from this presentation, and then they can get into the class itself. Let me just check the timetable for the NAC OSCE class because so the NAC OSCE class today is February 4th. Yeah. So you'll be doing musculoskeletal system, all right? Musculoskeletal system. So I'm going to go through this class so that you can have time to also prepare for the class, because the musculoskeletal system class will be at 8:30 p.m. EST. So that's why we're also conducting this class around this time, so that you can have time after this class to prepare and go for that. The essence of this class is, to keep emphasizing on the importance of communication, because MCQ1 is all about communication, right? It's all about communication. So that's exactly what we are going to do today, communication. So I'll say again, welcome to MedCognito's NAC OSCE class today. And today we're going to focus on abnormal liver enzymes and liver disease, okay? How are you going to deal with us in your mock or in your NAC OSCE? And so I have some people joining us. Doctors, don't hesitate to put your comments in the comment section, and then we'll just take it from there. So I'll say it again and again and again and again and again. Focus of the class is to continue to emphasize on the fact that it's not just the facts. I remember there was a day I was doing a class for a group of people, and someone came in, very eager to present a case. Very eager to present the case, and I was like, okay, go ahead and present the case. And doctors, you'd be surprised. This guy, he knows his stuff. I really, like the fact that he knew his stuff, because don't also forget that the NAC OSCE exam, the focus of the NAC OSCE exam and the objectives of the NAC OSCE exam is the same as the objectives of the MCCQ1. Okay, so this guy knew his stuff. He knew his stuff totally, but then he just ran through the whole thing and did not even allow me as a patient who was, working alongside with him to even speak. And he's just dumping the things on me. So I want to really emphasize, and that is what I want to make sure that, as a group, we get that the focus of this class is to continue to emphasize on the fact that it's not just the facts, but how the facts are communicated in the OSCE exam is what makes the difference. How the facts are communicated in the OSCE exam, that is what actually makes the difference so far as the NAC OSCE is concerned. Okay, and if you want to watch a whole presentation on this, I did a presentation last week, and I don't know what time you'll be watching this so far as YouTube is concerned, right? You may be seeing this a year later. Just go to the live MedCognito presentations. You will see that I did one presentation on constipation, and before the constipation presentation, I took time to talk about, how to effectively communicate, and I gave even exactly what you need to say in order to get the best out of the whole thing. So how you introduce yourself matters. I'm not going to waste your time on this because we've already gone through this in that previous presentation. Kindly go back and check it out. Okay, now how are you going to nail the introduction? You've got to smile and maintain eye contact. That's number one. Number two, you've got to use calm, clear tone of voice and establish trust. And number three, you've got to practice and demonstrate active listening. These are the things which will help you to nail your introduction in the NAC OSCE. The next thing is, if you want to nail your NAC OSCE, please avoid interrupting the patient. And this does not only apply to NAC OSCE, it applies to both NAC OSCE and even in real life. If you want to come across as a doctor who has good bedside manners, please avoid interrupting patients. Let them communicate what their frustrations and what their burdens are. And then based on what they will tell you, you can use that to really tell them, what they must know. So this is, because of the fact that we have a whole book on communication. A whole book on communication. That is why I'm sharing this over and over and over and over and over again. Because communication is the big thing. For me, I'm telling you, communication is the big thing. And many people, this week will be receiving their communication guru from MedCognito. Okay, we had quite a number of people who purchased that book. I want you to know that communication is key. Doctors, it is not just about what you say. So you realize that in my NAC OSCE classes, I am not just giving the facts. After all, everyone knows liver disease and how to deal with liver disease in real life. But why am I focusing on the communication part? Because that is what will help you to stand out. For example, one of our former candidates from Ghana scored 667 over 700 in the NAC OSCE exam. Why? This is somebody who doesn't talk very quickly. He's very calm. He's very meticulous. He was in the top 1%. How did he do it? Very calm, very composed. He was very systematic. And he focused on the communication bit. Please, I really want to emphasize on that. So another trick you can use to, nail your NAC OSCE is to clarify and probe thoughtfully. What does the patient actually want? Clarify and probe. And you must also empathize and validate. So today, I'm going to not just give the facts, but I'll also teach you, assuming a patient throws something back at you. Hey, doctor, so do you have a problem with the way I drink or something? How you should say it. Doctor, do you think because my family member has this particular condition, I'm also going to get it? How are you going to address that particular patient in an OSCE situation? And doctors, until you have practiced, it can catch you unawares, right? Okay, so now let's go to the case. As I said, today's class will be straightforward. It will be very simple, and we will not spend too much time. We are going to focus on the history part alone. We will not do physical exam. We will not do post-encounter probe. We'll just do history, just the history part alone for today's classes. Very, very important. So if you are dealing with a case of liver disease or abnormal liver enzymes, how will you go about it in your NAC OSCE prep, okay? Or in your NAC OSCE program. At the same time, I'll suggest that please don't hesitate to subscribe to our MedCognito YouTube channel, okay? So that we can grow this and get the good word out there for as many people as possible to see. So let's get into it. Whenever you are dealing with liver enzymes or liver disease, I want you to look at it from various angles. You when you are practicing, I want you to practice it from the concept of maybe someone who has come to see family physician with abnormal liver enzymes. Okay, just regular abnormal liver enzymes. Maybe the person is traveling, or maybe the person is going into a particular work situation, maybe police force, RCMP or something, and they are requesting blood work, or maybe the person is doing that as part of their annual physical exam, and then abnormal liver enzymes have come. That is one. Number two, I also want you to look at it in the context of a patient who presents with jaundice. Okay, in the context of a patient who presents with jaundice. And number three, I want you to look at it from the context of a patient who is presenting with complications of liver disease. So whenever you are dealing with this, don't look at it one-dimensional. Look at it from various dimensions and how you can get the best out of the encounter. So we are not going to just deal with abnormal liver enzymes. We are going to look at it holistically. A patient presenting with jaundice, a patient presenting with abnormal liver enzymes, a patient presenting with complications of liver disease. Okay, so let's get into the game. So how am I going to introduce myself? And doctors, all you need to do is to copy word for word what I'm sharing. Okay, because remember, in your NAC OSCE, you're going to move from room to room to room to room. Okay, and so what you say in this room, the other examiner in the next room is not going to hear. So if you use the same way you're going to introduce yourself in all your stations, so far as you have gotten it nailed, that is it. There's no need for you to worry your head and try to change the way you're going to introduce yourself anytime. So for me, I have this template. Hello, my name is Dr. Bruni, and I'm the medical doctor in the NAC OSCE clinic, or the NAC clinic today. Thank you for coming in. Could I confirm your name and how you would like me to address you? Doctors, this should not take you more than 3 seconds. All right? This should not take you more than 3 seconds. And I need you to revise this over and over and over again. Say that if you're even asleep and someone wakes you up, you should be able to communicate the same thing. I'm here to help you with any concerns you might have today. Please feel free to let me know if you have any questions as we go on. When you do this, you've opened the door for a conversation. You've opened the door for a back and forth conversation. Remember, the NAC OSCE exam is not a monologue. It is a dialogue. You speak, I speak, and then we get the game going. All right. Number 2, remember that in the NAC OSCE, you are an actor. You are acting. Okay. So understand your script. And that is what I'm saying. If you can even memorize this particular introduction, you are good. Okay. So the patient presents with a chief complaint. Remember that I told you that this chief complaint is going to be in various ways. It can be either the patient is presenting with abnormal liver enzymes. It could also be that the patient is presenting with complications of liver disease, or the patient is presenting with jaundice. Okay, so that is why I did not just throw just the facts there. I'm going to give you the exact words you need to use. And that is how we teach at MedCognito. So if you come into the MedCognito NAC OSCE class, you realize that you have over 400 scripts. And those over 400 scripts are teaching you exactly what to say. Okay? Exactly what to say so far as every medical condition is concerned. So don't forget that, NAC OSCE focuses on the same objectives as MCQ1. So, for example, the patient has presented in with a complaint. The complaint could be like, you will ask the patient, what brings you in today? Or you could even ask it in a different way, like, could you describe your main concern in your own words? Right? And then the patient can say, doctor, I was called by your office to come in because I did some blood work, and when I checked, it looks like my liver enzymes were abnormal. Or, doctor, my wife has told me that for the past 2-3 days, my eyes have become yellow. Or I can actually start as a patient to tell you that for the past 2 months, I've noted that I've started developing some swelling in the feet. So doctors, the main thing is that I want you to always start your chief complaint with an open-ended question. What brings you in today? It allows the patient to be able to express themselves. So this is how I rather put my signature patient to respond. Well, I have a lot of symptoms. How do I know what's most important? Okay. And then now as a doctor, how are you going to come in? So that's okay. Let's work through everything together so we don't miss anything important. Doctors, you can see that so far, I've not really used any technical medical language, nothing. It is just simple conversation between me and the patient. Regular, everyday conversation. The reason why I said that's okay, let's work through everything together so we don't miss anything important, is because it's a patient-centered approach. It helps the patient to really focus and to know that, okay, the doctor is opening himself up so we can have an actual conversation. Okay? Now, Assuming the patient tells me that, doctor, I developed jaundice or I developed yellowish discoloration of my eye. Remember, all the time, whenever a patient tells you any concern, don't forget to go through your OCD, onset, cause, duration. So when did you first notice this problem? It's the first question you want to ask. Has it been ongoing or something that started suddenly? You also want to do that, okay? And then look at maybe the way the patient will respond. I'm not sure exactly when it started. Then if a patient brings in that form of communication, how are you going to chime in again? That's okay. Let's try to narrow it down together. Was it days? Was it weeks or months ago? So you see, first I gave an open-ended question. The patient could not give me any direct answer. Therefore, I've picked that open-ended question and I'm making it more specific. I asked about duration. The patient says, I'm not sure. Therefore, I'm narrowing it down. Is the duration in terms of days, in terms of weeks, or in terms of months? Doctors, please, are you following me? If you're following me, just type follow. I want to make sure that you are following me and I want to make sure that you can hear me clearly. Just type follow. Dr. Boni, follow. I'm following. I just want to make sure that you're following me so that we can go through this class systematically, okay? Sequentially. Good. Dr. Tanya, Dev, thank you very much. So that's okay. Let me try to narrow it down together. Was it in days? Was it in weeks? Was it in months? Okay. Now, next one. Because we are looking at abnormal liver enzymes, chronic liver disease, and jaundice, another thing you want to then jump into could be, have you noticed any change in the size of your abdomen or how your clothes fit? Why? Because in chronic liver disease, people can develop ascites. And then when you say this, the patient can say, okay, does this mean something serious? Well, as a doctor, how do you deal with it? It's something we'll investigate thoroughly to make sure we find the cause. So you see, at this time, you have not committed yourself. But at the same time, you've told the patient that, look, in case you've developed any abdominal swelling, it's something I'm paying attention to. Then I can go on to the next thing. Has there been any recent weight gain? So in the recent weight gain, I'm going to give you tricks on how to ask it in two different ways, okay? So have you noticed any recent changes in your weight? Either gain or loss. Because when somebody presents with abnormal liver enzymes, somebody presents with jaundice, somebody presents with complications of chronic liver disease, remember that one of the complications can also be liver cancer, right? So while in liver cancer, they may develop cachexia, they may lose weight, chronic liver disease itself, when they are retaining fluid and they are developing pedal edema, ascites, they can gain weight. So that is why you want to ask, have you noticed any recent changes in your weight? Either a change in gain or a change in the weight in loss. Have you gained weight recently without trying? Or have you noticed any swelling anywhere? You can ask this question in one of two ways, and that is why I've given you both. And then, I'm always bringing this patient, in a way so that the patient is probing further. Is it due to something I ate? And then when the patient says that, you can go saying, it's possible, but there are other factors we will look into, like water retention or other medical conditions. So this particular expression that it's possible, but there are other factors we'll look into, like water retention or other medical conditions. One thing is that you are opening the door for complications of chronic liver disease, but at the same time, you are also opening the door for other differentials of chronic liver disease, which can cause pedal swelling and water retention. So doctors, I have a question for you in the comment section, whether you're joining us on YouTube or you're joining us on Facebook. What other differentials can cause a patient to develop pedal swelling? Please, I'm not moving on until I see answers. What other differentials with that particular sentence I just put? It's possible, but there are other factors we'll look into, like water retention or medical conditions. What other conditions can cause pedal swelling that you must start keeping in mind if you are dealing with a patient with suspected liver disease? Please, I want to know, what are other differentials of pedal swelling? If you can get me 5, I'll be very happy. Okay, so Dr. Irene went for congestive heart failure. Beautiful. So it looks like congestive heart failure has taken the lead. Let's move on to another one. What other what other thing? Beautiful. Nephrotic syndrome. So we've looked at chronic liver disease, we've looked at congestive heart failure. Now we are looking at nephrotic syndrome. Okay, good. What other thing? I'm looking for 5 differentials. Congestive heart failure, nephrotic syndrome. I want 5 other pre-tibial myxedema. Beautiful, Dr. Jagdeep. Pre-tibial myxedema. So now I have 3: congestive heart failure, nephrotic syndrome, pre-tibial myxedema. Protein losing enteropathy. Beautiful, beautiful, beautiful. Protein losing enteropathy. That's another one. Please, can you give me one last one? We are looking for 5. You've given me, because you see, that's what I'm saying, that the NAC OSCE, more nutrition. Beautiful, beautiful. More nutrition. Beautiful, beautiful. So that is it. So you see, when I said that I'm not just focusing on abnormal liver enzymes alone, I'm also looking at other things. And this can help me, especially when I get to my review of systems, to know exactly what to say. All right? Okay, good. Now, still on chronic liver disease and, the start of the conversation, how has your appetite been recently? Have you been eating normally? When I do that open-ended question, and then the patient can then give you, I've been eating less because I feel full quickly. Okay, so as soon as the patient says that, you can follow up. So doctors, one thing you have to understand is that in the NAC OSCE, when a patient drops anything, don't just leave that thing the patient had dropped and go on to another thing to discuss. Rather, what you want to do is that whenever the patient drops a hint, you make sure that you probe it just a little bit. So I've been eating less because I feel full quickly. So what can I do as a doctor in terms of responding to that in the NAC OSCE? That's helpful to know. Feeling full quickly could be related to your symptoms. So we'll explore this further. Okay? So we'll explore this further. Dr. Aaron Smith says liver cirrhosis. Beautiful. Dr. Akano says lymphedema. Powerful. Okay. Now, after I've done that preliminary introduction, I want to go on to assessing red flags. Look, doctors, whenever you are taking any history, please make sure, whether it is headache, whether it is eye pain, whatever it is, please make sure to assess for red flags. Please make sure to assess for red flags. So the red flags I'm going to look out for will be jaundice, fever, features of upper GI bleed, and encephalopathy. Okay, jaundice, fever, upper GI bleed concerns, and encephalopathy. So how am I going to review these things? If I have to ask about jaundice, have you noticed any yellowing of your skin or your eyes? If yes, were they associated with fever or pain? Because that's another thing. Yellow discoloration of the eyes. It could be that, there's painless jaundice and there's painful jaundice. Painful jaundice can come in the form of cholecystitis, cholangitis, okay? And then painless jaundice can be like just chronic liver disease and liver cirrhosis. Doctors, by the way, please, while we go through this class, I'll suggest kindly click on the like and the subscribe button.
If your 9-to-5 job
kindly click on the like
but you have no plan in place.
Kindly click on the like and subscribe button on our YouTube channel so that other people can see it as well. Some people have already started liking it, but please do that. Okay, so reviewing jaundice, have you noticed any yellowing discoloration of your skin or your eyes? And when the patient says that, don't leave it, rather probe. Was there any associated fever or pain? Even you can even ask, was there any associated itchiness of the skin? You want to find out, okay? Then another thing you also want to find out, has this patient started developing any confusion, any signs of encephalopathy? So I'm worried about why I feel confused sometimes. Now, when the patient says that, don't just jump into conclusions. You can say something like this: confusion can be linked to several causes, including the liver or other medical conditions. We'll work on identifying the reason, because then that means that you are trying to let the examiner know that, look, there's even the opportunity for me to do further evaluation with physical exam. There's opportunity for me to do further evaluation with laboratory investigations. Okay, so you are already teasing the examiner, for the examiner to know that you know exactly what you're doing. You know that you can work this patient up. Okay, now what about how to ask about upper GI bleed? Have you noticed any black or tarry stools or vomited blood? And if the patient becomes, hey, what does this mean? Then you can say, I understand this sounds concerning, right? But it's important to know so we can address it properly. Doctors, look, so far you can really tell that I've not used any medical jargon. I'm just using simple English words. But then any person who is, a doctor or anyone who has any medical knowledge will also be able to pick up the kind of things I'm asking about. Remember that in the OSCE, it's not just about stating the facts, it's about how the facts are stated. It's not just about stating the facts, it's about how the facts are stated and communicated. Okay? All right. Now, another thing, when you get to the past medical history, and that is why I'm also taking my time to introduce each of these one by one. Why? This is what we call the art of signposting, and that is also something if you look at the way the medical council wants to evaluate you in your NAC OSCE. If you go to the website, okay, when you look at the way they grade superior performance and the rest, they're also looking at doctors who know how to signpost. So, for example, a way you can signpost is Mr. Ben, or whatever the name of the patient is. I would like to ask you a few more questions about your past medical health and even your current medical health, because this can give me a good insight into what is happening to you. Is that okay? As soon as you start saying things like that, you are carrying the patient along, but you are also directing the examiner for the examiner to know exactly where you are going. For example, if I'm going to Calgary, there's a signpost on the way which tells me 150 kilometers to Calgary. Okay, signposting is very, very important, and that is also something we teach you in our communication, like in a communication guru book, which you can get for just $24. At the same time, we also teach that to you in the NAC OSCE course, which is going to go on tonight after this class I'm having. So in relation to this patient who has jaundice or issues with possible liver disease, when you are dealing with past medical history, you want to ask about past history of liver disease, past history of hepatitis, past history of congestive heart failure. Why? Because in congestive heart failure, when it comes to right-sided heart failure, right, they can at times have hepatic congestion. Okay, you want to focus on blood transfusions. You want to focus on gastrointestinal and genitourinary cancers. Why? Because gastrointestinal and genitourinary cancers can metastasize to the liver. And then you can also focus on drug overdose and drug use. Doctors, please, I don't want to move too quickly. Please, are you following me? Are you following me? If you're following me, just let me know whether you're following. Just type yes, yes, yes. Yes, yes. Just type yes, 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 and let me know whether you are following this. Because, doctors, I say it again, how to separate the best candidates from the average candidates is how they communicate, not what they communicate per se, how they communicate. How they communicate, not what they communicate per se. Okay, all right. So, thank you very much. So, we have people following. Okay, so let's go on. So, in reviewing the past medical history, do you have any history of liver issues, hepatitis, heart conditions like heart failure? You see, the way I just dropped my voice, do you have any issues like liver disease, hepatitis, heart conditions like heart failure? Have you received blood transfusions for any reason in the past? Have you ever been diagnosed with cancers of the stomach, of the intestines, or the urinary system? Why? Because you are thinking about possible metastasis. Do you have a history of using substances or any previous overdoses? Why? Because some substances can have detrimental effects on the liver. For example, marijuana. For example, alcohol. Right? So you want to also probe all these things. But remember, use simple everyday language. Now, if you ask these red flags and the patient becomes concerned, doctor, do I have liver disease? How are you going to respond? Well, we will check for it if needed. But these questions help to guide us in ruling out conditions. And then, for example, if the patient tells you that I had hepatitis in the past, does it mean something now? Doctor, look at the way you want to respond. It's important to know this, since past conditions can sometimes influence current health. Doctors, are you seeing the way we are going about it? It's not just yes or no. You pick what the patient says, you wrap it, you present it in a good way so that the patient is at ease. Number one, the examiner knows that you know your stuff, and then you can carry the conversation going. Don't make it combative at all. Now, let's go to past surgical history. So you can ask, have you ever had any surgeries, such as gallbladder removal or cancer-related procedures, or surgeries for bleeding in your stomach or in your intestines? When was this procedure, and have you had any complications since then? You can also ask, when it comes to complications, you can ask this simple question, that was there any follow-up care required after your surgery? Because you are still thinking, was there any complication? Did the patient have to see the specialist after those complications occurred? Okay. Now, assuming the patient asks you, do my surgeries mean my condition is worse? You can say, surgeries can provide helpful insights into your current health and will make sure to factor in everything. Doctors, you see, you imbibe what the patient is saying, and then you take the next step. Never ever underestimate anything the patient will tell you, whether in the real clinic, whether in your OSCE exam, be it the Australian Medical Council, be it PLAB, be it NAC OSCE. Don't do that. Don't underestimate it. Okay. If you want to come across as a very good physician, so far as your conversation with the patient is concerned, these are the patient-centered approaches you want to use. Then you also want to review medication history. So with the medication history, you can tell them, Mr. Smith, I would like to ask you a few more questions about some medications you use. Is that okay? And then in the medication history, so far as liver disease is concerned, please make sure that you ask questions about diuretics. Make sure that you ask questions about antivirals. Make sure that you ask questions about hepatotoxic drugs like Tylenol or acetaminophen, like amiodarone, like methotrexate. Right? So if we to do the medication review, can you tell me about any medications you are currently taking, including any over-the-counter or herbal remedies? Look, one sentence, you've captured everything. For example, medications like acetaminophen, antivirals, or anything for your heart or your liver. Are you taking any of these medications? And the reason why I'm asking you this is because these medications can have an effect on your liver. Do you know why? So if you ask the patient and the patient says, I'm taking amiodarone or I'm taking Tylenol, do you know why you were prescribed these medications? Have you had any side effects from these medications, like nausea, like confusion, like any other symptoms? So doctors, again, don't just pick something and throw it and move on. Pick it, probe further before you move on to the next thing. Okay? So if the patient asks you, could my medications be causing this? How do you know? How do you respond? Some medications can affect the liver or other systems. Beautiful response. We will look into it. And looking into it will mean, please, Mr. Smith, can you give me your medication list so that I can look at it? Okay. So that's a very, very good way to look at it. Now, family history. So you can say, Mr. Smith, I would like to ask you a few more questions about your immediate family and your extended family. This will help me to know whether there are conditions which run through your family or not. Mr. Smith, are you okay with that? So when Mr. Smith says, yes, doctor, you can go on, you want to focus on family history of liver disease, family history of a form of hepatitis like autoimmune hepatitis, family history of gastrointestinal and genitourinary cancers. You want to ask all those things. So when it gets to family history, you want to ask a question like, does anyone in your family have a history of liver disease, hepatitis, or autoimmune conditions? And then you can follow up by saying, are these relatives immediate family members like your parents or your siblings? And were these conditions diagnosed at a young age or later in life? Hello, doctors, please. Hello. Are we all following? When these questions, I really like them. Remember, NAC OSCE is not only about what you say, but how you say it. Okay. So if the patient asks you another question, hey, doctor, does it mean I am at risk for the same thing? What you can do is you can say family history can give us clues, right? But it does not always mean you will develop the same condition. Doctor, if you say something like this, you are communicating to the patient because you have introduced the concept of risk, right? But at the same time, you've also let the patient know that not everybody at risk eventually goes on to develop the disease. All right? Then, social history. In the social history for a patient with abnormal liver enzymes, or in a patient with suspected chronic liver disease, or in a patient with jaundice, you want to make sure that you ask about alcohol use. You want to make sure that you ask about smoking history. You want to make sure that you ask about IV drug use, tattoos, and travel. And when you're asking about the travel, you also want to make sure that you inquire about high-risk sexual behavior. And when that patient traveled, what did the patient eat? Because you are looking at jaundice. And when you are dealing with jaundice, you are looking at hepatitis A, which is foodborne, hepatitis B, C, and D, which is bloodborne, and hepatitis E, which is also foodborne. So you want to make sure that when you're asking about travel history, have you ever traveled to a place which is endemic with hepatitis? Okay, that's number one. Number two, can you describe what you ate? Or what did you eat when you were there? Because then you are trying to grab the concept of, what happened? Did the patient develop some hepatitis A? Number three, I want to ask you some questions, but these questions are going to be confidential. I'm just asking them to help me to probe further. Okay, how many sexual partners do you have? And when you travel to that hepatitis endemic area, did you get a new sexual partner? Beautiful. When you say it that way, beautiful. Now, I want to draw attention to this thing. When it comes to alcohol, do you drink alcohol? As soon as the patient says, yes, I drink alcohol, if so, how much and how often? Now, one thing with alcohol, and almost all of us know this, but I'm going to emphasize on it, is that don't talk about alcohol without asking about the cage questionnaires. So if the patient tells you, I drink alcohol, you ask how much, how often. If you think that the answer the patient is giving you is leaning towards problematic alcohol use, doctors, please don't forget to cage the patient. When I say cage, what I mean is to use the cage questions. The cage question is CAGE. Okay, so the first question you want to ask, if you think that the patient is developing issues with alcohol dependence, is very simple. The first question is this: have you ever felt you need to cut down on your drinking? That's the first question. That is the C, cage. Have people annoyed you by criticizing your drinking? That is the A, annoyed. C is cut down. A is annoyed. Have you ever felt guilty about drinking? That is the G. And then the E is eye-opener. And how to ask that eye-opener question is, have you ever felt you needed a drink first thing in the morning? Don't go saying, have you ever felt you needed alcohol as an eye-opener? No. Have you ever felt you needed a drink first thing in the morning to steady your nerves or to get rid of hangover? This is how the experienced physician will ask the cage questionnaire. Have you ever felt the need to cut down on your drinking? Have people annoyed you by criticizing your drinking? Have you ever felt guilty about drinking? And have you ever felt you needed a drink first thing in the morning to steady your nerves or get rid of hangover? Okay. And so assuming the patient says, hey, doctor, so are you judging me with these questions about my alcohol use and my drug use? You can say, not at all. No, I'm here not to judge. I'm just trying to understand everything that might affect your health. Beautiful. So, the patient threw a bomb at you. You took the bomb. You digested the bomb. Now you are presenting it in a patient-friendly manner. Doctors, please. Are you seeing something tonight with the way I'm communicating? I want to know. Are you seeing something tonight? If yes, please kindly go to our YouTube channel as well and click on the subscribe button right away. Are you seeing the way we are trying to communicate? Please, this is how you communicate in your NAC OSCE exam. This is how you communicate in your NAC OSCE exam. It's not just throwing hard facts at the patient. No, it's about taking the patient's word and, digesting it and throwing it back. Okay? Now, after you've asked about alcohol and you've used your cage questionnaire, you want to ask, do you use any recreational drugs such as injection drugs, or have you had any tattoos recently? Why? Because of the risk of hepatitis B and hepatitis C. Okay. And for travel, have you traveled to any areas where hepatitis is common or needed vaccines before going? And if yes, did you get a vaccine? Okay. And have you been exposed to environments where liver infections might spread? It could be, a very poor tattoo salon or something, right? Now, after you've done all this, then you want to quickly review your systems. And I'm going to go through that quickly. So you want to review their mood, their sleep. Is there any drowsiness? Is there any confusion? So have you noticed any changes in your mood? Any trouble sleeping or feeling confused? Do you feel more tired or drowsy than usual? Or have other people mentioned changes in your behavior? Right? You want to do that. Then, cardiovascular and respiratory. Do you get short of breath, especially when lying down? Because you still want to rule out the other differentials like heart failure, right? Have you had trouble breathing at night or needed to prop yourself up with pillows? This is basically talking about orthopnea and paroxysmal nocturnal dyspnea, so far as heart failure is concerned. But patients with chronic liver disease will not present with those symptoms, right? Gastrointestinal and genitourinary issues. You want to ask, has there been any weight loss, any acolic stools? Has there been a change in the color of their stools? Has there been any dark urine Have they noted any dark tarry stools? Have they noted any nausea, vomiting, any bloating, any anorexia? So have you noticed any unintentional weight loss or weight changes, any light colored stools or dark urine? And have you experienced any rectal bleeding? Have you experienced any nausea or any bloating recently? And have you been eating less than usual or feeling full quickly? Why? Because in chronic liver disease, if they develop nausea or if they develop ascites, that becomes a problem, right? And then you want to quickly review the musculoskeletal and dermatology as well. Have you noticed yellowish discoloration of your eyes, your skin? Are you having any rash or itching? And do you bruise easily? Why? Because the liver is responsible for creating some of the clotting factors, right? So do you bruise easily or find it harder for bleeding to stop when you get cuts? If the patient tells you, for example, doctor, interesting that you're asking me these questions, I have all these symptoms, what does it mean? Then you can say each symptom helps us piece together what might be causing your condition. Still, I've not used any big medical language, but we are still going through. So, doctors, this is another thing we teach MedCognito students, and it is stated emphatically in the communication guru book. Okay, please never, ever, ever, ever forget to FIFE your patient. So I have a question. Please, who can type the meaning of FIFE? I want to know who can type the meaning of FIFE, because somebody will say, what does Dr. Bruni mean by FIFE? Never forget to FIFE your patient. Who can type the meaning of FIFE? FIFE, F-I-F-E, FIFE. F-I-F-E, FIFE. F-I-F-E, FIFE. Who can type it for me? What does FIFE mean? FIFE. In an OSCE station, what does FIFE mean? Doctors, what does FIFE mean? Please, I want to know. Type it for me first before I move on. What does FIFE mean? I'm waiting for your answer, doctors. What does FIFE mean? Okay, feeling. Beautiful. Feeling. Dr. Irene says feeling. I stands for ideas. Beautiful. What else? What else? F stands for function. Feelings, ideas, function, expectation. That's what Dr. Tonya Durant is saying. Beautiful. So please never forget to FIFE your patient in your OSCEs. So I'm going to break it down for you. I'm going to give you ways you can FIFE your patient. Last week I didn't do that. Today I'm going to do it. So in your exam, never ever go saying, how do you feel about this condition? What are your ideas about this condition? You know, how do you function with this condition? And what are your expectations? No. You must FIFE without your examiner knowing you are FIFing. That's a beautiful thing. You must FIFE without your examiner, you must FIFE, your examiner must know you are FIFing, but you must not use the words in FIFE. That's what I'm trying to say. You must not use the words feeling, ideas, function, and expectation. So I brought up some occasionally I would drop the feeling and all those things. But if it comes to feeling, doctor, and all you need to do is to pick one sentence out of this and just use it throughout all your OSCE stations till it becomes one of you. So if you want to master the FIFE and you want to master the feeling, how to say it in an OSCE station. For feeling, it's their feeling in relation to the disease, okay, especially their fears. So what are you most concerned about? So you see, doctors, I'm FIFing without using the word feeling. What are you most concerned about? Do you have any specific fears or worries right now? I'm still FIFing, okay? I imagine you have had many different feelings. This is the time I'm using that word. As you have coped with this illness? Because, by the time the patient has come to you, maybe the patient has read something on Google and Google is already giving the patient palpitations, right? So you want to make sure. Sometimes people have fears that they keep to themselves and don't tell their doctor. Are you harboring any such fear? If you ask like that, that is how to, do the first F. Then when it comes to ideas, how are you going to ask it? Ideas and explanations of the cause of symptoms of the illness. Doctors, please never ever underestimate the fact that your patient does not know what may be going on. Okay, so what do you think might be going on? That is one way you can ask about the ideas. Another way you can ask is, what do you think this pain, or what do you think this jaundice, or what do you think this yellowish coloration of your eye, or what do you think this abnormal liver enzyme means? And then, do you have ideas about what might have caused this illness? So that is when I use that word ideas. But if you can use any of the first two sentences, that is awesome. Then when we go to function, how has your illness affected you day to day? You see, doctors, everybody can tell that you are FIFing, you are asking about function, but you didn't use the word function. Or what have you had to give up because of your illness? The patient might say, I used to play ping pong, I used to play lawn tennis, I used to play squash, I used to go see my grandson perform at the dance class. Now I can't do it. Doctors, please, is today helping you? Is today helping you? Okay. And then what goals do you have now in your life? How has your illness affected your goals? How does this illness affect important people in your life? Doctor, that's what I'm saying. Just pick a notebook, write 2 sentences out of each of these. So function, this is how I'm going to ask about function in my NAC OSCE. Expectation. What do you expect or hope I can do for you? So instead of using the word expect, you can rather say, what do you hope I can do for you today? And do you have expectations about how doctors can help you? Or do you have any hopes about how doctors can help you? Or what do you hope this treatment will do for you? Or what do you hope I can do for you today in this clinical encounter? And what are your expectations about what might happen with this illness? Okay? So, doctors, never ever forget to also summarize your findings. So I'm just going to do a quasi summary, and I intentionally wrote it down so that you can see how we try to summarize a clinical case. So thank you for sharing all your concerns, Mr. Smith. To summarize, you've been experiencing fatigue, bloating, weight changes, swelling and jaundice, along with changes in your appetite and stool or urine. You have a history of hepatitis and known to have taken antivirals in the past. Your lifestyle history, including your alcohol use, recent tattoo, and travel to hepatitis endemic areas, provides an important context, and your symptoms like confusion, breathing difficulty, and unintentional weight changes suggest we need to investigate potential liver, heart, and digestive issues. So you see, doctors, in your NAC OSCE as well, don't forget, it is not just about getting the final diagnosis right. It is about how you got there. So even in your summary, you've thrown in the fact that you are still thinking about differentials, right? So our next steps will include a physical exam and tests like blood work and imaging to identify the cause and develop a management plan. Doctors, look, tell me, if you went to a doctor who spoke to you this way, and after that summarized everything like this for you, come on, how will you feel? Remember, we never used any big medical jargons. Remember, we just stuck to the scripts, signposting, and went on, right? So please, don't forget to be systematic, because in the NAC OSCE, if you look at the MCC website, your systematic approach is going to be considered, number one. Number two, In the NAC OSCE, how you signpost, how you move from one point to the next will be looked at. In the NAC OSCE, how you summarize as well will be looked at. So, doctors, thank you very much. As I told you, tonight there is a musculoskeletal class at 8:30 p.m. Let me just check the time again. There's a musculoskeletal class at 8:30 p.m. EST, and it's almost 7 p.m. EST. So you have 1.5 hours to grab some water, to stretch out, and then go into the other class. Okay. What I'll suggest is, if you want to master communication like what we are doing, just grab a copy of the Communication Guru. It's just $24.99. Can use that to prepare yourself and get things going. What I will do is I will share the link in the comment section, and you can also join tonight's class. You can join tonight's class, and then participate, where you come in and you'll be grilled, because in the musculoskeletal, the teacher is going to give you, musculoskeletal scenarios, and you will present, and then you are going to get a lot of feedback. Okay, I am doing the one-way teaching, but in the class it's going to be two-way. You are presenting, the teacher is like the patient, and then after that, when everything is done, the teacher will give you some feedback. So for those who are asking how they can grab a copy, I've put the link in the comment section, and when you click it, it will take you to this website, and then you can just order. That is also the timetable for the NAC OSCE. So you're doing MSK. Next week, you're going to do obstetrics and gynecology. Then you do neurology, hematology, and then on and on and on you go. Cardiovascular and respirology. Okay. So doctors, that is it. And if you want to join, you can join tonight by making a 3-part payment, just 599 CAD every month for 3 months. Or you can make a 2-time payment, 799 CAD every month times 2, or you can pay just 1 time. Okay, I'll look for the link and also drop it, and then we will take it from there. So doctors, if you have any question, kindly drop it. If you don't also have any question, please, I'll be waiting for your calls. You can drop, or you can send me a WhatsApp right now. As I bring my class to an end. I'll be here to, answer all your questions. And I'm putting the link to registration for tonight's class in the comment section on Facebook and on YouTube. Doctors, thank you very much for spending your evening with me. Please don't forget, in the NAC OSCE, it's not only about what you say, but it's also about how you say it. I'm putting the link in the comment section. Please, if you're interested in joining the NAC OSCE class, just kindly click on that link or give me a quick call right now. Then we will add you to the team. Thank you very much. This video will still be on YouTube and on Facebook, so you can go back and watch it. Thank you very much. Have a wonderful evening, doctors. All the best. Bye-bye. Bye-bye.